Hi guys, I'm Dr. Ayele Okine and this is This Vet Wants You to Know. Today we're talking about leptospira or leptospirosis. Leptospirosis is a bacteria that we can see in the environment. Typically it comes from urine, so any kind of water source or any soil that is soaked with urine saturated water containing this bacteria potentially exposes dogs to this bacteria. Humans also can get it as well, so we can get it directly from these water sources, or if our dog contracts it and they urinate and we actually aren't cleaning things up with appropriate protective equipment, we can actually get it from our pets as well. Cats tend to be really resistant to it, so we don't tend to see cases in cats. There are some experimental infections, but cats seem to be pretty resistant to it, so we don't tend to worry as much about that in felines. This bacteria actually looks like a spiral. So it's a spiral and it has some hooks on it, and that allows it to penetrate through the gums. It can penetrate through any mucous membrane, so eyes, nose, mouth, urogenital tract, and it actually can go through skin, especially if the skin is wet and softened. And so that's what makes this bacteria really infectious and hardy in the environment. Once this bacteria is kind of taken into the body, it rapidly kind of goes around the body. The big areas that we worry most about are going to be the kidneys and the liver, because this bacteria likes to colonize or set up shop in the kidneys, and that causes kidney damage. And then those toxins can actually damage the liver and cause the liver values to go up. There is some bacterial colonization in the liver and other organs throughout the body, but primarily the kidneys are the big area that we worry most about. Most of these patients, when they come in, they're very sick. They are dehydrated, they've been vomiting, they've been drinking and urinating a ton, they could be having diarrhea, they don't want to eat, they could be having breathing problems from, again, this bacteria kind of going throughout the body and wreaking havoc. On blood work, we often will see that the kidney values are elevated, and it's variable whether or not we'll see changes with the liver values. There's also other changes that we can see around the body depending on how much inflammation there is. So there's a number of other changes, but probably the hallmark change that we see is a patient with both liver and kidney value elevations. But again, the kidneys are the main one. The way of diagnosing this bacteria, there's a couple of ways of doing it. Whenever there's multiple tests, that means no test is perfect. So typically in the very beginning of the disease, within the first week, we can actually see bacteria being shed in the urinary system. And so actually looking for bacteria, so PCR, DNA testing in the urine or the bloodstream where this likes to hang out during the initial illness, we can get a diagnosis from that. After about that week period, what starts to happen is the body will start to make antibodies against it, and so that will clear out the bloodstream, and that will actually decrease the amount of intact bacteria that are shed in the urine. And so what we find is those PCR tests are not good after about a week. After a week, again, I mentioned that antibodies are being produced, so we can actually test the antibody levels. And what we actually want to see is either a very high single antibody level or an antibody level that goes up over a couple of weeks, because that indicates that there's active exposure. The only way that you're going to make more antibodies in a short period of time is either if you've been vaccinated or if you've been exposed to the actual infectious agent. So those are the main ways that we diagnose it. There are other tests that can be done, but those are usually the two that we do in practice. And if we're not quite sure how long a pet's been sick, sometimes we'll do both tests to see if we can get a positive. And I've certainly had some pets that will be positive on one or the other. Treatment involves really aggressive supportive care. So these pets, as I mentioned, are really, really sick. Their kidneys are taking a hit. In a lot of cases, we can see that they need tons of fluids to keep up with how much they're losing through their urinary system, because this bacteria interferes with the kidney's ability to be able to concentrate urine, and so we have to give all of that fluid back to them so that they don't continue to get dehydrated. There are some pets that I've seen where their kidneys actually decrease the amount of urine they're making, so they can essentially start to go into kidney failure. Our hope is that with treatment that will improve quickly, but in some cases these patients actually need dialysis to remove those toxins until their kidneys can heal. They also need symptomatic treatment, so if they're having diarrhea or vomiting or anything like that, we treat those symptoms as well. The main treatment though, because this is a bacteria, is we want antibiotics, and there's antibiotics that help to clear it around the body, and that's typically what we use first to help these patients feel better so they can start eating, maintain their own hydration, and go home. And then there's a more potent antibiotic that's used to actually clear all of the bacteria out of the kidneys. Because what we can see is even when these patients improve clinically, if we're not also clearing their kidneys of any bacteria, they sometimes can have the bacteria hang out in the kidneys. It doesn't make them sick, but it can expose other patients that are coming into contact with the urine. I say patients, but other animals, other people that come in contact with the urine, it can put those subjects at risk. So we also want to make sure that we're doing our due diligence, preventing these patients from going on and exposing, other organisms, other beings, other animals, people. So we want to make sure that we take all of that seriously. Again, I mentioned that this is a bacteria that is zoonotic, meaning that people can get it as well. And again, we can either get it from the same environment where our pet has gotten it, or we can actually get it from our pet. Now the good thing is, once these patients are started on antibiotics, they're usually not infectious within about 48 hours or so. So after that, we don't have to worry quite as much. But again, we have to make sure they go through the entire antibiotic course so that they're not, again, being a potential reservoir for this infection. These are diseases, this is a disease that we can see that patients can pass away. So I kind of make it sound like, oh yeah, it's easy peasy, but in a lot of cases, these patients are really sick and we can lose them, especially if they go into kidney failure where they're not making any urine. Urine is obviously a way of getting rid of toxins, and if that is not being produced, if the kidneys shut down, without dialysis, these patients can die. We also can see that these patients will hold on to a lot of fluid, so if they're not making a lot of urine, and we're still giving them fluids to try to flush things out, that fluid can build up in their lungs, it can overwhelm their heart's ability to pump it, it can cause fluid to build up underneath the skin. So again, these are patients that are really sick, they need really close monitoring, and again, sometimes they need to go to universities that have dialysis if we're going to save them. We also can see that if the kidneys have been damaged permanently from this bacteria, that even if we can get the patient to recover, we sometimes will end up in a situation where now we have chronic kidney disease that we have to try to manage. So again, this can be a really severe disease and have consequences beyond the initial hospitalization. There is a vaccine that we can use that actually helps to protect it against all different types of lepto. It's a vaccine where there's two shots, so one initially and then one about a month later, and then after that once a year. Really young puppies, we tend to not recommend getting them vaccinated within the first 2 months of life, just to prevent any sort of reaction. And then there is a potential for reaction to this vaccine. It's not a perfect vaccine, meaning that we can still see patients that get sick, but most often it does prevent them from having clinical signs. But again, we usually still have to test them, and again, we're relying at that point on antibody testing to see if there's a really high antibody level or if things are going up over time. So anyway, that's my brief talk about lepto. If you have any questions, let me know. And again, as always, please subscribe, please follow me, please give me feedback, let me know what you want to hear about. Otherwise, I'll see you in the next episode. Thank you.